evening. Welcome to Sound Health on Lagos Television. I am Ola Sumbo. Thanks for always finding time to join us on the program. Today we are looking at adolescent mental health. The World Health Organization says 1 in 7 10 to 19-year-old experience mental health, and they are largely left untreated. Today on the program we are taking a look at how to address this condition in depth. The conversation begins after this break. Please stay tuned. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Leonard Okonkwo, consultant clinical psychologist, hypnotherapist and psychotherapist. And he is going to tell us what adolescent mental health is all about. Good evening, Dr. Okonkwo, and thanks for joining us.
Good evening, and thank you for having me here.
All right, Dr. Okonkwo, according to the World Health Organization, 1 in 7 adolescents experience mental health. Tell us, what is mental health in adolescents?
Well, mental health in adolescents has to do with, generally, mental health going to, as regards the adolescent. So if you want to understand what it really means, we're talking about what mental health really is. And then it's good to know that mental health is not the same as mental illness, but health itself is a state of physical, mental, and social well-being. So if you look at it now from the context of health, mental health, you're looking at the adolescent, his mood, his behavior, his emotions, and in fact, put in a different way, how he thinks, how he feels, and how he behaves in his relationship with other people. So that's what we're talking about. How healthy are these parameters? That's what mental health is all about.
Okay.
In the adolescents.
All right. The World Health Organization says half of this mental health starts by the age of 14. Can you please share more light on this? Half of all mental health cases starts by age 14.
Yeah, we can even say that it starts much earlier, but then that is it's an authentic figure. And what that means is that before the onset, before then, you will have started to notice some things here and there, but by age 14, these things become more prominent. You start to see remarkable changes in the way the individual thinks, the way he behaves, and in his relationship with other people. You start to see remarkable changes. You know, what he used to do before, he will not do, or he starts to develop some newer things that are strange. And usually I like to look at it from the angle of, how abnormal these things are. Because if you look at it from what we normally talk about, we talk about the 5 Ds that helps us to recognize when there is a problem in a child or in an adolescent. You look at how deviant his behavior is, how dysfunctional his behavior is, how dangerous his behavior is, and how distressing the behavior is, and the duration, involved in what you have noticed in his behavior. So these are important issues when you're talking about the mental health in the adolescent.
Okay, so can you be more specific now? What are these mental health? What are the signs? Could it be depression, loneliness? Some people would even tell you at that age, what are they thinking about? They are not paying for their fees, they are not paying for any other thing, or they don't have much responsibility to shoulder.
Yeah, just like I said, when we're talking about mental health, it's not necessarily the presence or the absence of mental illness, or how healthy. Mental illness, of course, there are many mental illnesses that are usually associated with adolescents. Common among these are depression, anxiety, substance abuse disorders, and so on. So if you're talking about depression is a mood disorder. In other words, depression itself has to do with the mood of the individual, and it is usually characterized by low mood or sadness, unshakable sadness, persistent sadness, and loss of interest in pleasurable activities, or what was pleasurable before suddenly becomes stops doing them, and other things like poor concentration, fatigability, or tiredness that are just unexplainable, sleep problems, and even appetite. He might sleep too much or he might sleep very little, and then his appetite too may be affected. And some may compensate by overeating, while some may just have no appetite. And very important to note in depression is suicidal ideations or even suicidal attempts. And in the area of anxiety, you find palpitation, you find trembling hands, hyperventilation, and so on like that. So these are some of the things you will see that will make you know that indeed the individual is having some mental health challenges. And of course, I didn't talk about substance abuse, which is becoming very rampant now, very common. And you start seeing them use substances that are not approved and becoming addicted to these substances. And many of them eventually lead to some more major health conditions, mental health conditions. Yeah, so you look at all these things, they are pointers that the individual is having some mental health challenges.
Okay, so most of these times they experience emotional blackout. At that age, they are transitioning from one age group to another. How do they navigate this terrain to avoid depression, which could lead to suicide and all that?
Well, it's good to know that these things don't just start overnight. They are insidious. They start gradually. And one of the things that can help the youth to navigate this turbulent period is awareness, advocacy. One, people have to be aware. Let them know what mental health is and what they can do. And they should be taught early. And secondly, there are other healthy habits that they have to imbibe. For example, they should be taught, or they should be made to be aware that substance abuse is a no-go area. Because when one is hooked up on substance abuse, thinking that there are ways of coping, they find out eventually that they are much worse than what they think. And also, the home environment is very important. Many of these mental health issues develop as a result of traumatic childhood experiences. And it shows that the home will have to play a very important role, being protective at the formative years, avoiding children being insecure, falling into the hands of rape, for example, falling into the hands of rapists, abusers, and so on. These are things that, even from the home front, the parents and significant others can take care of. And then building trust is very important, because at this point when children are transiting, they are becoming more and more independent. They're experiencing things they didn't experience before. And it is very important that they are able to talk about these things. It's also important for the significant others to know that they don't need to wait for the children to ask questions before they give explanations about how to deal with certain things. For example, peer pressure, which is one of the things that adolescents experience. How do you deal with peer pressure? These are things that the significant others, the parents, uncles at home, ought to educate the children about, even before they grow up. Bullying, for example, these are some other things too. What do you do about bullying? When one is bullying the other, part of the bullying experience is to make the person know that if you report, I will deal with you. If you report, I will do this, I will do that. Helping them to understand that no matter the threat that comes from anywhere, that you are for them, you are standing by them, you will protect them, it becomes easier to open up and tell you their experiences. Well, just to mention a few, these are some of the things that can be done for the youth to navigate, to come out, to be able to transit effectively from this period, to adulthood.
All right, thank you so much, Dr. Okonkwo. I'm glad you also mentioned that not all mental health cases in adolescents are associated with substance abuse. There could be, personal problems, emotional problems. They are trying to figure out what next in their present phase and all that. Okay, so according to the World Health Organization, most of these cases in them, they are left untreated. How do we address this? How do we ensure care is available and accessible?
Well, all hands must be on deck. What I mean by that is that for effective treatment, one, there has to be infrastructure. We have to have infrastructure. We have to have manpower and manpower development. In other words, we have to have more mental health professionals who can help, in the management of these issues when they come up. Right now, there's a shortage of manpower in the area of mental health. Even the available manpower, they are every day trooping the international airports, flying abroad for greener pastures. These are some of the things that the government can do. And the schools also have a part to play. I think every school should have counselors, because counselors are there to help, because they make the adolescents, they make them feel at home and easier to confide in them because they are trained. In a situation where you have schools where there are no counselors, then you leave these students or adolescents to the mercy of their peers and in social media. And you know how, as much as social media can be very helpful, it can also be very destructive. Because in the process of that, many have been exposed to all kinds of things, pornography and so on like that. So, all hands have to be on deck. The parents, the teachers, the society, the law enforcement agents too. Because many people do a lot of things and get away with it, and they even boast that they will get away with it. But the moment they start seeing that, you can't just get away with just anything, like in a lawless society, when you begin to understand that, there are consequences of wrong actions, people will begin to sit up and they will have a much better atmosphere for the children to grow and to transit to proper adulthood.
Okay, apart from protective and supportive environment for this age group, are there tips they can, adopt the adolescents now to scale through mental health?
Well, there are other things too that I didn't mention, like chronic diseases. These things are also important in mental health. So if your body is sick, the mind too can be sick. And that's why it's also important that our physical health is taken care of. We all know how much emotional trauma, how much emotional conditions we find among people who are chronically ill, like those who are living with sickle cell, for example. Education, proper education, at the onset, even at marriage, helps to reduce the number of sickle cellers and eventually reduce the number of people that will break down mentally as a result of chronic your physical health. Sleep hygiene is very important. When people are deprived of sleep, it affects them mentally. That is sure. Teaching people values. Many times, emotional issues as a result of dysfunctional or wrong thinking. When people think wrongly or their thought pattern is faulty, the result is you find some emotional issues. So people need to be taught right values. We orient them. That too. Problem is every, and in fact, another factor is poverty. Poverty still has to be reduced. In the society where so much people are living with hunger and insecurity, definitely mental illness will abound. So part of what we need to do is to reduce the level of poverty, reduce level of insecurity, in the society, and that will also help, to reduce the amount of mental illnesses that we have. All right, so what can they do? Avoid peer pressure, learn to escalate when you have a problem, learn to appreciate what you have, learn to create proper relationship with significant others, with parents and with teachers, and to know when to recognize when there are red flags and to escalate. No to substance abuse. That's very important. If you just keep hammering on it, that is a no to mental substance abuse. Anytime someone tries to introduce them to it, whether they tell them about how good it is or how good it's not, you already understand by default that it's a no. These are some things that the individual himself can do. Eat well. I've talked about hygiene, and then physical exercises to help your emotional health. Well, these and many other things, like I say, are things that the youth themselves can do to help themselves attain better mental health status.
Dr. Leonard Okonkwo, thank you so much for your time and expertise on adolescents and mental health in adolescents. Thank you so much. We really appreciate your expertise.
You're welcome, and thanks again for having me here.
All right, I have been speaking with Dr. Leonard Okonkwo, consultant, clinical psychologist, hypnotherapist, and psychotherapist. He has been sharing his expertise on adolescent mental health. Sound Health continues with trending health report from around the world. Please stay tuned. Mental health is not a taboo. Seek help early enough. You heard what Dr. Leonard Okonkwo said earlier. He pointed out that mental health, half of all mental health cases in adulthood starts at the age of 14. So it is not a shame. Seek help early enough so you can beat mental illness. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.